So what happens when you come to our office for the first visit? Well, first of all, you have to be under the care of an ophthalmologist or an optometrist. We won't see a patient if they're not currently being seen by an ophthalmologist or an eye doctor. And before we start the acupuncture, we'd like for you to have an exam by your doctor at least 2 weeks prior to starting the treatments. And we'd like for that exam to include a visual acuity exam as well as something called an OCT. And that's where it's like an ultrasound for the back of your eye, where your doctor can actually see the health of the blood vessels and all the things that are going on in the back of the eye. And when you come to see us then for your first appointment, we're going to take a detailed Western medical history as well as I'm going to take a detailed Chinese medical history. And I'm going to find out exactly what's going on in your body and how it's affecting your eye issue. And then I'll choose the acupuncture points based on that. Again, none of the acupuncture needles go in the eyes. All the points go into your hands, your feet, your arms, and your leg. We're also going to come up with things that you can do at home, including dietary changes that might be helpful, exercises, and other lifestyle issues that might help with your eye diseases. We'll then do a series of 20 treatments. We like to do those twice a day for 10 days. And then at the conclusion of those 20 treatments, we'll have you go back to your eye doctor and ask that they do the same test they did prior to starting the acupuncture treatments, which is to measure your visual acuity and do another OCT exam, and then have them compare those test results from the first test to the one concluding the acupuncture treatments. If there's some improvement in the eye health, we'll continue on with series of 10, groups of 10 treatments until we reach a plateau. And at that point, we'll do what is now maintenance treatments for your eyes at that point. That will be required. These eye diseases are chronic illnesses just like diabetes, Crohn's disease, and some other issues like that. You will require periodic treatments to help maintain the vision improvement or the improvement in the health of your eye. Again, the goal is to keep you from losing more vision, and hopefully some people will gain some vision back. We don't know who's going to be a good candidate for that until we do some treatments, but that's the goal of our treatment, is to maintain the vision that you have, and with those patients that have a certain type of improvements, you may get some vision acuity back. We'd like to help you with your eye issues. If you have any questions or concerns, please give us a call. Thank you.